I said, hey, you're pretty good at this. Have you thought about maybe it was geometry? And I said, have you thought about maybe being an architect? Because I would see his drawings as well, and his eyes just lit up. And I said, did I say something wrong? And he said, no, miss. I've just never had a teacher to talk to me like that. Teachers were not very nice to me. They just saw me as a gang member. They didn't see me as someone who was even intelligent. And I said, but dude, you're smart. I said, do you know that parents will pay you back then $30 an hour to tutor their child in math? You don't have to sell what you're selling. That could be, what you sell is knowledge. His eyes were huge, like, really? And I said, yeah.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Determinants of health and how it intersects with the other social determinants of health. 2, why this person left medical school and found purpose in the intersection of equity in education and public health. And 3, some useful tips for academic and career development for people that are pursuing public health degrees as well as other degrees. If you enjoyed today's episode or any other episodes, be sure to subscribe so you don't miss another episode. Leave a 5-star review so that you let us know we're doing great with the show, and share this with someone who gets some value with it. It really helps the show get out to more people and helps other people discover what you can do in public health. Lastly, if you like to support, there's a link below where you can become either a one-time or a monthly contributor. So check that link out below. Shout out to my 2 monthly contributors, Dr. Ashley Hickson and Ethan Sen. Really appreciate you all. And thank you, Tiffany Francis, for the one-time contribution recently. I hope that you'll enjoy the show, and be sure if you want to support the Public Health Millennial, there's a link below. Thank you.
Hi, this is Ashanti Carter. I'm an education consultant, and you are listening to Public Health Careers.
Today, we have someone working towards education equity. She conferred a Bachelor of Arts in Human Development at UC San Diego, worked as a school teacher before getting a Master's of Public Health at Charles R. Drew University of Medicine and Science, as well as a Doctor of Education at the George Washington University. She currently works as the co-founder and CEO of Heroes Ed, as well as an adjunct faculty at Trinity Washington University and chair of the DC office of the State Superintendent of Education. We have Ashanti Carter, Ed.D. candidate, MPH. Welcome to the show.
Thank you for having me, Omari. It's a pleasure to be here.
I have this clapping that I always forget, but we'll get. Woo! Yeah. Pleasure to have you. Glad that we can have you on the show, and look forward to hearing more about your insights and your story and your path. So how do you identify, and tell us how you're doing?
Sure. So my pronouns are she, her, and I identify also as just a disruptor and a public health practitioner and educator. Thanks so much. And how am I doing? I am a doctoral student, doctoral candidate, so I am in the throes of the dissertation, so I'm a little stressed, but that's okay.
Yeah. And as you say that, like, what's the difference between a doctoral candidate and a doctoral student, for those that might know?
Sure. So a doctoral candidate is someone who has actually defended their proposal, and a doctoral student is someone who hasn't done that yet.
Okay, thank you, because I didn't know until I got into my Master's of Public Health program. I brought the difference. So yeah, thank you for sharing that. I think it'll be helpful for other people. And so you're someone that's working towards education equity. So would you like to talk more about education being a social determinant of health?
Of course. So in public health, there are 5 social determinants of health. And so these are things that are non-biological, Omari. So with education, that's one of the social determinants of health. Let's just think about it. We're going to think about it like a story. So imagine a child living in a higher resource community. So their schools, coming from those property taxes, their schools are well resourced. So they can take advanced placement classes, honors classes, they can go on field trips and all of those good things. So with education, it then takes us to economic stability, because then that student can get a career, right? And so with economic stability and you have that career, you have access to health. So medical benefits, right? So then you start thinking about, okay, in my community, there's a hospital that's close by or a clinic, and the doctors, they listen to me. So that's also about quality of care, right? And then there's the community. So living in a well-resourced community where there isn't any mold, right? There isn't any lead paint, or, the community, there isn't a lot of violence where a person has to live in fear. It's walkable. And the grocery stores, they sell fresh food, not rotten food. Then there's the social and community context. So people in the community, right? They're reflective of the richness of the community. So looking at those things, your education, healthcare access, neighborhood and built environment, your social and community context, economic stability, all of those are the social determinants of health, but education, it gets you access to all of that. And I'll even add, research has shown that if a student or anyone who graduates from high school, 10 years of life is added to their life expectancy. So education is literally life and death. So that's why it's the most important social determinant of health.
Thank you for that story, and I think it illuminates the intersections of the social determinants of health, and just how education plays into economic stability, which plays into food and access to healthcare, and especially in this country, the United States of America, having an education and the type of job that you get really ties you to what type of access to care you get in a lot of circumstances, or what lack of access you get. And I appreciate you sharing all of that. So just tying into that conversation, what does public health mean to you? Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show.
Public health, to me, it means empowerment. It means freedom, right? That's what it means to me as an educator and as a person who has a master's degree in public health. I use it for education, to educate students, to educate people in the community, so that we can advocate for ourselves and find our own voice, right? So that we're empowered.
Absolutely. And I think it's so important to think of it that way. How do we give power to people to advocate for themselves? Because they're the ones who are facing the issues. And especially when we talk about marginalized communities, they're the ones that need the advocacy, and just to know how, in order to get their needs met and to get the systems and structures to change around them so that they can live better lives. So yeah, I appreciate you sharing that.
Mm-hmm.
And then getting into your collegiate story. So as you said a little bit earlier, you're a current doctoral student, but way before then, you got your Bachelor's of Arts in Human Development at UC San Diego. So what was the thought process of going into this work? And yeah, let's go from there.
You see the big smile on my face. I will put it to you this way. I'm a first-gen college student. Right. So my mom actually was in college at the same time that I was in college. She decided to go back. And living in California, the University of California school system, that was touted as one of the best school systems. And I actually, after graduating from high school, I went to a community college. I was not mentally ready to go to a big university. I was terrified. So going to Antelope Valley College, that was the best decision that I made because it saved my parents a ton of money and it gave me a chance to grow up and learn about the collegiate system. Funny story. This is how green I was. I had an 8 o'clock class, right? So I'm in the center of the college, just sitting down, and I look at my watch and it's 7:50. Then I look again, it's 7:55. Then I look, it's 7:59. I'm looking around, and then I look, it's 8:05, and I'm just thinking like, hey, isn't the bell gonna ring? Isn't the bell gonna ring to tell me to get to class?
Right.
Oh my gosh. Welcome to adulthood, the most savage hood that we will ever live in, right? So I was so embarrassed just walking into class late, right? A pre-calculus class of all classes. So, see, I was not ready for a 4-year university, looking around like, hey, the bell's not ringing. What's going on? So, yeah, I transferred to UC San Diego. I actually wanted to go to Xavier University because at that time I wanted to be a physician. So my parents said, no, it's too far. You're the eldest. You're a female. Don't want you going that far away. Pick a University of California school. And being from Los Angeles, they thought, of course, UCLA. And I just said, no. I picked UCSD because it had my major. Not the best way to pick a school. The University of California school system, their classes are huge. And they're not very diverse. So I was in class with 300 other people, like with organic chemistry. And also, like I said, it wasn't very diverse. I was probably like the only Black student in the class. So I think we were at that time 1%. It was a beautiful campus. And then the most important part, it was actually on a quarter system. So I didn't even know what that was, being on a quarter system versus a semester system. So I would say to any student, don't do what I did. Actually go on a college tour and learn about your colleges, learn the difference between a semester system and a quarter system. But being a first generation college student, how was I to know? So, I love the education that I received from UCSD. It taught me how to compete. It taught me how to manage my time because it was so fast on the quarter system. But looking back at it, it wasn't the school for me because the classes were just too big and I felt lost.
That's a great point, and I think something that a lot of people should think about, especially as they're entering into the college system and seeing like what size class would be most suitable for you, especially in those early classes, because some schools, big schools, have big classes. so a lot
yeah. My teacher, it was like I was at a Janet Jackson concert. He had the little microphone, and he's all the way. It's a huge auditorium, and I'm sitting back like, oh my goodness, I feel so lost. I feel really lost, but. I sat in the front row and made sure that my professors knew my name. So that helped.
Yeah, that always helps. Like just that little thing that you can, that's what I did from that. One of the changes I implemented from my bachelor's into my master's program and completely helped in a lot of different ways, just like psychologically, I feel like it helps as well. I'm also glad that you mentioned the like going to community college, first of all, because I think that's important, because too many people in this world get forced into university at too young of an age when they don't know what to do, and that's problematic in itself, especially when debt and other things come into play. But I'm glad that you were vulnerable enough to share like your naivety around like what time is the bell gonna that's not even something I thought about, but that's hilarious.
yes indeed.
yeah Okay, so thinking about like you wanted to go to Xavier, and then your parents wanted you to go to UCLA, you wanted to go to UC San Diego. I love San Diego, by the way. It's a beautiful city. did you go in and as a human development major? Because I know you said you wanted to become a physician. So talk to us about that thought process.
Yes. So there's something that's called a oh wow, it's an impacted major, right? So impacted major means that everyone and their mother is majoring in that thing, and it's super competitive. So when you're a transfer student, you're competing with everyone in your major versus when you're going into college, like to a university, you're competing with everybody in that school. So I didn't know that until I started working in the Office of Admissions and learning those little tricks. So I chose a major that was not impacted. So human development, it wasn't impacted, so it would give me a great chance, a higher probability of getting into a University of California school. Also, I like the major because I could take a variety of classes, not just science, like hardcore science. I could also take sociology. And so I'm a lot older than I look, right? A lot older than I look. So with that, I believe that as doctors, you should be able to use both sides of your brain. So taking the hard sciences, that's great because you're going to see it on the MCAT, the Medical College Admissions Test. But you should also, at that time, the MCAT was different. So I also wanted to take other classes like sociology and psychology and learn more because teaching is something that I had in the back of my mind because when I was a high school student, I was a tutor and I really liked doing that.
Okay, and that works into everything right now. Because so after undergrad, you became a substitute teacher at Los Angeles County Office of Education. So tell me about first, like the thought process before, like what kind of work and like how you enjoyed that. Because you said in high school you were a tutor, now you're a substitute teacher. But what was the thought process like? I'm still planning to go to med school. This is like along my path.
Yes, I needed a job where I could still study and use my brain. And I just had a natural knack for teaching math and science. And I started out as a paraeducator with LA County Office of Education. So with LA County, it's actually alternative education. So these are young people who have been expelled from their school districts. So I had other jobs before that. I was a children's social worker trainee for LA County after I graduated. I didn't like that, just seeing abused children, that really bothered me. So going into teaching, that was a little bit better, but it was still the kinds of kids that I worked with when I was a social worker. But it so happened that as a paraeducator, we weren't allowed to teach. So I was placed in a class and being, a math nerd wanting to go to medical school, the teacher had a really hard time teaching the addition of fractions with different denominators. So yes, okay. I'm putting the teacher on blast. I'm not going to mention the teacher's name. And so I'm sitting there like, okay, you're a teacher and you don't know how to do math like that? So he was struggling, Omari, struggling. And I'm sitting there. So then the kids, it's alternative ed. So they're cussing him out, all of this other stuff. And I'm just sitting there like, okay, you just can't sit there. And so I raised my hand. I said, hey, let me help you out. So I'm, going through the problem like, oh, all right, think about ND, right? So N, it's on top, so it's your numerator. D, it's on the bottom, it's down, it's your denominator. So we're going through finding the common denominator and who walks into the classroom? The principal. We're not allowed to teach as paraeducators. So I thought, oh no, I'm about to get fired. I'm about to get fired. So I just kept going. I kept going. And the students, they were really engaged. So then afterwards, I give the dry erase marker back to the teacher. And then the principal, he says, Ashanti, Miss Fisher, I wasn't married then. Miss Fisher, can I speak to you outside? And I thought, oh my goodness. Then the kids, ooh. So, I'm thinking, okay, so I walk outside And he said, so you were teaching? And I said, no, I wasn't teaching. I was facilitating a lesson. I was just helping out. I wasn't teaching. I promise I wasn't teaching. He said, just relax, relax. He said, never seen a math lesson like that. You're good. I want you to take the CBEST. It's a California test for someone to be a teacher. And he said, you take the CBEST and pass it, I'll put you in your own classroom. And I said, really? And he said, yeah, it's more money. I'll put you in a classroom. You're good. You have talent. And I had been teaching ever since. Did a little stint in med school, didn't like it. Went back to education, my love. So I can say teaching, it changed my life, because then they put me in the juvenile detainment camps. So my students were actually incarcerated. And I taught math and science with males who were Black and brown, and it forever changed my life.
Okay. Wow. And okay. Well, yes, that's awesome on you to like take leadership and stand up in the class and say, hey, I'm going to teach this, because the teacher has no idea what is happening. I'm glad that you didn't get fired and you were kind of like promoted from the situation. That is awesome. Okay, so you said that you went to med school for a bit. Was this before your master's of public health?
Yes.
Or, yes. Okay.
Yes.
So how long were you a teacher before applying and getting into med school?
Oh, 6 years.
Okay.
The MCAT, it was so difficult for me to pass, and I received some pretty bad advice. Back then, they didn't have post-baccalaureate programs. Like I said, I'm a lot older than I look. So back then, in those days, you would basically have to start over or pay a lot of money to retake your science classes. Remember, I said UC San Diego, it was super fast. Well, learning organic chemistry in 5 weeks, that's not helpful.
That's not fun either.
Yeah, it's not fun. It's not helpful. So my grades suffered a bit. So looking at that, a person told me, hey, go to one of those Caribbean medical schools. Mm-hmm. And I said, really? I said, okay, well, my MCAT scores, it wasn't that bad, but I would have had to have taken it again to get into a U.S. medical school. So I went after teaching, and I didn't like it. I actually hated it. I loved what I was learning. I just didn't like the school, love the island, love the people, but my heart wasn't in it, and so much had happened when I was a teacher, and I thought to myself, wow, I saved more lives as a teacher than I could possibly save as a physician. This just doesn't feel right. So let me go ahead and leave, and I pivoted in my career.
Okay. Wow. And which island did you go to, first of all?
Dominica, the mountainous island.
Okay. My mom has some cousins that are from Dominica, but I don't know if I've been there ever in my life.
It's beautiful.
Yeah, need to get there. Okay, mm-hmm. So was the work that you did at the juvenile detention camp before you went into med school?
Mm-hmm.
Okay.
Yep. Yes, I did.
So tell us about more about that experience and like what that did for you, as well as like that in your perspective of going to med school and thinking about, I've saved more lives in this work that I was doing previously than what I believe med school would be able to give me.
Sure. So working with these young men who were incarcerated, I was doing public health and didn't know it. Mm-hmm. So when they would come into class, I taught math. So I taught, algebra, geometry, and algebra 2. And they were all in the same class. So I had to do 3 lessons at once. So it required me to manage my time as a teacher, all the while having my head on a swivel, because some of my coworkers were assaulted by the students. So that never happened to me, thank God. They respected me, and they even protected me and defended me, when one of their fellow students got out of line. So they saw that I cared, and I let them know I'm here to do my job. I'm not here to down you. You know, I'm not here to judge you. I'm not here to scream at you. I'm here to do a job. So allow me to do my job and we'll be fine. You know, so just the things that they would say, Omari, I'll tell you one story. With one young man, I was doing math and he was great. He was sharp, picking it up. I said, hey, you're pretty good at this. Have you thought about maybe, it was geometry. And I said, have you thought about maybe being an architect? Because I would see his drawings as well. And his eyes just lit up. And I said, did I say something wrong? And he said, no, miss. I've just never had a teacher to talk to me like that. You know, teachers were not very nice to me. They just saw me as a gang member. They didn't see me as someone who was even intelligent. And I said, but dude, you're smart. I said, do you know that parents will pay you back then $30 an hour to tutor their child in math? You don't have to sell what you're selling. That could be, you know, what you sell. It's knowledge. His eyes were huge, like, really? And I said, yeah. And he said, miss, I get out and there's great programs called Homeboy Industries in LA. And that's where they teach the young men life skills. And he said, I'm going to Homeboy Industries. You know, should I talk to them about that? I said, yeah, and talk to them about college too. And so I said, you do the research on being an architect. Omari, he did the research, brought me printouts. Oh, miss, I can go to this college. Yeah, you can go. Another one, he had great teeth. And so he was always smiling. And I said, wow, you should be a dentist. And so he was always just like, really? I said, yeah, you should be a dentist. When I left medical school and then started working at Charles Drew, I actually ran into one of those students at a community college. And he said, hey, I remember you, because I heard someone screaming, Miss Fisher, Miss Fisher. And I'm looking around like, who is calling me? And it was one of my former students. What are you doing at my school? Oh, I'm here. I'm working at, you know, Charles Drew as an admissions counselor. What? You're not teaching anymore? No. Oh, but Miss Fisher, people like me need you. They need you. I'm sad that you're not teaching anymore. But I just want to tell you that you probably thought I wasn't listening to you, but I was. And that's why I'm here. And I live with my aunt and my uncle. I left the neighborhood, Miss Fisher, and I'm doing really good. So yeah, save lives, lots of lives.
Goosebumps across it. Goosebumps. I really love that, and thank you for sharing that. And yes, definitely saving lives, giving them exposure, and affirming that they can do great things in this world.
Yes.
So yeah, that's amazing. That's amazing. Okay, so you were an admissions counselor while you were also a Masters of Public Health student at Charles R. Drew University of Medicine?
Yes. So that's what I did. And then I got a promotion and was working at the College of Medicine at Drew.
Okay. So you worked as a substitute teacher, become a juvenile detention camp teacher. Then you went to med school, said this isn't for you, and came back to the US. When did you know about public health and wanted to pursue a master's in public health?
So it started when I was an admissions counselor at Charles R. Drew University of Medicine and Science. So Drew is in the Watts Willowbrook area of Southeast Los Angeles. So if anyone has heard of the Watts riots, Drew was actually, it was established because of that. People in the community, they needed a hospital and they needed a training site to train people from the community to give back as health professionals. So at Drew, I knew about Drew when I was a little kid, growing up in South Los Angeles. So I was recruiting for the Masters of Public Health program that they had there. And I thought, okay, I need to go back to school. And I thought, hey, I really like this program. They're talking about social justice and all of these things that I've done as a professional, I want to learn more. And that's when I caught the bug. I ended up applying and I was accepted and haven't turned back since. It's a great program.
Love that. Love that. And just take me back one more time here. So
Okay.
you're in med school, or like you just said, I don't want to do med school anymore.
Yep.
What is like that mindset of like right after you quit? Like how was your mindset? Like how do you get through that? What was the thing that you were thinking at that time?
I was depressed. I felt like a failure because I had wanted to be a doctor since I was a little girl. So I felt like I had let a lot of people down. It took me a while to get over that. And working at Charles Drew, that really shifted my mindset. I really had to pray, and just ask God, show me the right way to go, because obviously medicine isn't it. So if I'm going to pivot, point me in a direction where I can still make a difference. And this is going to sound bad, but I don't care. I want to make a difference where also I am being paid a nice salary, where I can live a life that I deserve. And being at Drew, boy, oh boy, I got a lesson in post-secondary education, university life, medical school, just how universities work, and it changed my life.
Wow. Okay, well, thank you for sharing that and being vulnerable about that. And I know that that is a tough decision for anyone to make, especially like, as you said, this is like something you think about, and a lot of people put it on you to be this thing, become this person, and to step away from that and do your own thing and find what is meaningful for you is hard for many people. But I'm glad that you were able to take those steps, and I applaud that. I wish I did the applause sound, because yes, we need more people as well to say, yes, I can do public health work and I can get paid well, because I deserve to get paid well. I'm not gonna start a commentary on like this state of like state and federal public health, but that's a different topic. But yes, I think everyone in public health doing great work should deserve to get paid well and advocate for yourself and get yourself into positions where you are paid and appreciated in a lot of different ways. So I appreciate you illuminating that as well.
Yeah, pivoting with purpose.
Right.
With purpose, Omari.
Right. And if anybody just coming at you, let them come at me first, because you can say that all day long. All right. So you're admissions counselor. You saw like this public health stuff. You decided to pursue your public health degree. You said you also got other roles or promotions at Charles R. Drew into epidemiology tutor and a medical student affairs coordinator. Do you want to talk a little bit about those?
Sure. So probably like not even a year later, I got promoted. Someone noticed my work ethic and said, hey, we sure could use you at the Charles Drew UCLA medical education program right down the hall. And I said, okay, how much? And I liked the number, and I went ahead and did it. And even with that, it changed my life, Omari, because I really got a chance to learn a lot about medical education and the different roles that are involved in educating our future doctors, the deans, the chairs, the faculty, the coordinators, program managers, and so forth. And then seeing, the salaries is kind of like, oh, so I don't have to be a physician to help people and have that salary. Okay. Wow. All right. And then with public health, because Drew's mission is all about developing the next generation of healthcare professionals and health equity champions. So we learned a lot about social justice. So I'm thinking, okay, this is awesome. And I work with third-year medical students. So learned all about the medical education curriculum. And my prayer was, okay, God, don't let me be bitter and be mean to these medical students because I didn't make it. Please don't do that.
Right.
And you know what? It was fine. It was fine. Just helping them through it. And then seeing the things that they went through. Yeah, I just knew like, no, I am not committed to this. And I am so happy that I left when I did. I am not committed because medical school is quite the journey, and you can get dismissed from medical school. And if you are dismissed from medical school, they don't give you a refund of all that money. So for me, it was a blessing. So working with the students, the third year medical students, so they're transitioning from the basic science curriculum to the clinical curriculum. So putting together their simulations, making sure that they were prepared for their clerkship exams. So proctoring, doing all of those things, it gave me joy because I got a chance to learn about education, medical education, but also put a public health spin on it, all while learning and just developing myself as a professional.
Yeah, that's an awesome place to be. And I feel like to observe what the system looks like on the back end. And I think, to your point, like there are so many positions out there that do get paid well salaries. It's just like we don't hear about it, and I think that goes like pay transparency and all of that as well.
Yeah.
But yeah, I appreciate you sharing that. Okay, so let's say you're in the process of finishing your Master's of Public Health program.
Mm-hmm.
What is the thought process? So like what were some takeaways from your Master's of Public Health program, and then what was the thought process for the next step of your career?
So finishing up my master's degree, I was proud because it's kind of like, look at me now, from med school dropout to finishing graduate school, completing a thesis. And I was very happy. So the next step was, okay, what's the next advancement in my career? Where else can I go? And that's when I got the call to come back east, because the thing about it, what I love about Charles Drew is that I was working with professionals who developed me, and working with Dr. Daphne Kalmas, who at that time, she was the interim dean of the College of Medicine. We had pathway programs where we worked with high school students, and undergraduate students, to get them prepared for medical school. And so she knew my story, and she said, what better person to do it? You can tell them not to do what you did. And then here are some takeaways. And also, you were a teacher. So here you go. And that's what I did. And I loved it. And the students that we were working with in the Watts Willowbrook community in South Los Angeles, they loved it as well. And, I thought, okay, well, how can I fuse together public health and education? And one of my professors, Dr. Bita Amani at Drew, she said, yeah, you can actually do that. You can actually get your doctorate in education. And I thought, really? I don't have to do a PhD in public health? She said, no, what you can do is go ahead and get the doctorate in education. And that was in the back of my mind when I got the to come to the DC area.
That's awesome. It's always awesome to get recruited, as well as it's so important for us to get exposed to things, because as we're starting off in this podcast, you didn't know about the school bell because you didn't know, and there are a lot of things in life that we don't know, and there's no one telling us it. So how do we get exposed to it unless we are put into those situations or someone shares this information? Because as you said, you're thinking about a doctorate in public health, and she's like, no, you can actually get a doctorate in education, and both use use the intersection of your MPH and your doctoral in education to work on that education equity that we were talking about before. So I'm really glad to hear that. And then what was that thought process of okay, yes, I want to get my doctorate of education. Tell us about that.
Okay, so in church, I just heard about everybody's blessing, right? So everybody's blessing is they get these free degrees. And I'm thinking, why doesn't that ever happen to me? I had to pay for my master's at Charles Drew, even though I worked there. I had to pay for my bachelor's degree. I had to help my parents with that. Everybody was getting these free blessings, right? Just, oh my goodness, like, Lord, what about me? So I was recruited I did a stint at Hopkins for a bit. And I really like working with the kids there, but with nonprofits, it gets a little tricky. So I thought, no, I feel comfortable working at a university, kind of the way in the capacity that I worked at Drew. So I was nosy and I started looking at different positions and at different schools. And I saw that the George Washington University Milken Institute School of Public Health, yay, they were looking for an executive assistant to the chair. So I said, oh, I actually worked with an executive assistant, but it was to the dean. So I kind of know what they do. You know, it's higher level administrative assistant work. So I can do that. I worked as a secretary way back in the day. So I can do that. And so I was curious, like, okay, well, who's the chair? Because Charles Drew is a minority serving institution. GW is not. It's PWI. So I said, okay, let me just, see who the chair is. And it was this guy named Dr. Thomas Leviste. And I immediately recognized the name. And I said, oh my gosh, I read all of his papers. We studied this man's work in my public health program. Okay, that job is mine. He's a giant in the field. Oh my gosh, I can learn from the best of the best. Googled him because the name, it was like, okay, I don't know what kind of name that is. So I Googled him. He's a Black man from Hopkins. So I said, okay, that job is mine. I nailed the interview. And working with Dr. Leviste also changed my life. I've never met anyone so humble. I've never met anyone so caring at the level that he was as an administrator. He was the only Black chair, at the School of Public Health. So just being in different groups where he would talk about that and also help to develop me professionally, where it's kind of like, wow, how do you feel about that, being like the only Black chair? And he was just like, doesn't bother me. I've been hired to do a job. So, that's what you want to do. And I'm thinking, well, what about being a leader? I mean, don't you feel uncomfortable? I don't, and he was saying, well, you could be a leader too. And I'm just like, no, that's too political. And no, I don't think I can do that. He said, but Ashanti, and he said something, Omari, that stuck with me to this day. And he said, Ashanti, you talk so much about change and wanting to make a difference. Well, you can make a difference when you are in a role a leadership role where you are in control of the resources. So you have to get the confidence and the tenacity to get in these roles where you can enact change. And that stuck with me. Because I thought, wow, that's true. Why complain about, oh, we don't have this. Oh, well, the powers that be are saying that we can't do this. We don't have the budget for it. But if you control the budget, then you can do it. So that really changed my life. And going to GW, one of the perks was that if you're staff, you get a free degree. So my doctorate was free. So I got my free blessing.
Hey, shout out to you. Give thanks. That's awesome. And yeah, I think like those pivotal conversations in our careers, or just like and I'm glad that like you're sharing this and all other people can hear it, because I think that that's important to hear, because a lot of times, as you say, it's like we complain about a lot of things, and instead of like trying to get into those positions and trying to influence it from those positions of power, which we definitely need a lot more Black and Brown and Indigenous people in those spaces. So definitely appreciate that. And tell us about like what was that like working and then going and getting your doctorate, or like I know you're currently getting it right now, so so tell us about that.
I was afraid because then I began to have flashbacks of medical school, of imposter syndrome, and then thinking about UC San Diego, people who don't look like me, and just feeling invisible, right? Where people will isolate you and ignore you. But that didn't happen. It didn't happen in my doctoral program. It was very diverse. We had everyone in the program, which was great. And I can say that I love my cohort, very nice people. So the imposter syndrome, sometimes it creeps in, but I had to tell myself I'm not perfect. I'm here to learn. I'm a student just like everyone else. So if I say something wrong or if I mispronounce a word, so what? I'm a human. You understand what I said, just correct me and let's move on. So I actually loved it. I love learning. I had a full-time job because Dr. Leviste is now the dean at Tulane School of Public Health and Tropical Medicine. So then I was recruited to serve as program manager of the Rodham Institute, and that's at GW School of Medicine and Health Sciences. Very demanding job. So trying to juggle that, and I'll say this, I do not recommend anyone working full-time while they are pursuing a doctorate. Don't do that to yourself. Mentally, it was horrible. I'm just being honest. It was horrible working 10 hours, sometimes 12 hours, and then you have to read. When you're in a doctoral program, you're reading probably like 1,000 pages a month because you have a lot of papers to read. You have a lot of books to read. You're also typing a lot of papers that will influence your dissertation. You're doing your literature review. It's a lot. It's a lot. So I really had to take care of myself mentally and use my vacation time and use my sick days and advocate for myself. I had a great supervisor, she was very understanding, and it was wonderful. And it still is wonderful. Taking the comp exam, your comprehensive exam, that I had to take off work for that, because that's then when you become, you go into the next phase of your doctoral program. So then after that, then there's the proposal defense. I, once again, being naive, it's called a proposal defense for a reason. You're defending it. So your dissertation committee, they're not going to be, I wouldn't say they were mean to me, because they were not. They were asking very tough questions. So you have to defend it. My dissertation proposal defense was supposed to have lasted at most an hour and a half. Mine lasted for 3 hours.
Wow.
They grilled me like a hot dog on the 4th of July. And this was also during COVID. So everything changed. It was virtual. No one was prepared for that. But I mean, I remember with one committee member, and he's amazing, but the questions that he was asking, I could feel a tear Like,
Right there.
I could feel a tear. It was like, don't you cry. Don't you cry. And it was, well, I chose this because of this.
Mhm.
And he kept going. It was like, no, I'm sticking with this because of this. This is my reasoning. And yeah. Now, when they said, yeah, you passed, we just want you to make these changes. That's when I said, okay, you can calm down.
Let that tear
Yeah,
out, right?
you can roll down this cheek.
Yeah. That definitely a lot in that, but like I appreciate you sharing that, because that's important for people to know. And like I'm glad that you're sharing your insight of you don't think it is a good idea to do it full time, because as you said, like it is very demanding, and as well as like just a time suck, especially if you're doing both things, having to like not only read stuff but then like remember it, and as you said, like write as well. And there are all these different factors that come into it, so like really knowing yourself. And I'm guessing like most people definitely see your point there, or unless you're taking the PhD or the doctoral degree, maybe part-time, that might be something that's a little more doable.
Mine was part-time. Yeah, because they won't let you be full-time if you're working a full-time job.
Right.
So
Okay.
even though I was taking 2 classes, that's still a lot when your job is very demanding. So
Right.
I had to do webinars. There was community work. It's a lot.
Right.
I was managing a career pathway program. No, I don't wish that on anyone.
All right, Ashanti does not recommend. So.
Nope.
So tell us more about the job as the director for the Rodham Institute, because you said that was a stressful job, but you didn't share like more of what that like took. What do you have to do in that role?
Yeah, so it was a good stress. So more of social justice work. The founding director is Dr. Jahan Gigi El-Bayumi. She was faculty at GW. Now she's adjunct at Georgetown because the Rodham Institute had since moved, and I've since left because I have to focus on writing my dissertation. But our mission is to improve the health and well-being of DC residents. So as the program manager, I led a career pathway program. It's called the Health Education and Leadership Program, which was actually established by Miss Tracy Bass. She's my coworker. And because Miss Bass was so busy, they gave the program to me because of my experience in education. And so I wrote the curriculum. We would meet twice a week on Wednesdays and Thursdays. These are 9th graders all the way through 12th graders. So I would provide them with academic coaching because since I am an education consultant, I took pieces of my business, Heroes, and I incorporated it into their curriculum. So the students received academic coaching. They also received SAT prep and career exploration. So I would actually contact health professionals that I knew, and they would provide a presentation on their career and the pathway, and even give them a lesson. And then I would also work with the parents. So that was just one part of my job. The other part of my job was actually putting together and organizing webinars on various topics that impacted communities of color. So with April coming up, it's National Public Health Week. So right now it would be promoting the webinars for National Public Health
Right.
Week and any events. And then it's called the Rodham Institute for a reason. We're named for former Secretary of State and First Lady Hillary Rodham Clinton's mother, Dorothy Rodham. So working with Hillary Rodham Clinton and, the Clinton Institute, just, doing all kinds of great work and fundraising. So it was a lot. So even what I described, that wasn't even like, I mean, that's like the majority of it. And it was a lot. It was a lot. Love the work, but it was just a lot.
Yeah, understandably, especially knowing that you have this whole other doctoral program going on and like switching between all those different brains is tough work. So definitely understand that. And
Mm-hmm.
I like the point of view saying that like just using some of the work that you already do with your education consultancy to bring it into the work that's going on there to really support them in things that you're already teaching and already know and already expertise in. And we'll talk a little bit about heroes in a little bit.
Mm-hmm.
You are also currently an adjunct faculty at Trinity Washington University. So tell us about getting that, and then like what has that meant for you?
It seems like every job that I've had, I've never had to apply. Someone just asked me. So
That's a blessing.
it is. So
Mhm.
I at that time I was, yeah, because I recently stepped down like a few days ago. I serve as the chair of the Health Sciences Industry Advisory Board of the District of Columbia's Careers and Technical Education, and that's through ASI. And so I was at a conference and someone ran up to me, "Hey, are you Ashanti?" And I said, "Yes, what's going on?" And so she said, "Yeah, I need a favor." So I said, "Yeah, what is it?" And it was, "Hey, do you know someone who can teach health professions something to our dual enrolled students?" And this was back in, I think, at the beginning of August. And so I'm thinking, oh, okay, they're trying to recruit for spring. And so I said, yeah, I know a lot of people, who can do it. I can talk to my colleagues at GW. Oh, great. So I said, oh, when is this for? Like January what? And so the person looked and said, no, it's for fall. And I said, oh no, no, these people will like beat me up if I came to them asking, can you teach in person, not virtual, in person at 8 o'clock in the morning? No, ma'am. So I said, okay, wait, talk to me about the class. What is it? And so she said, well, you would just introduce health professions to the students. And I thought, oh, I already do that, with what I'm doing at Rodham. So I said, well, I'll do it. You don't need that. And so the dean of Trinity, she was sitting at the table. And so she's eating and she's looking. So she said, oh, and you're a doctoral student, right? So I said, yeah. And so she said, okay, you would qualify. So in the conference, I go to my session, I'm teaching, I'm leading. So the dean comes up, she says, oh, well, you don't have to like do a lesson. Just go ahead and apply and I'll just hire you so we can get you started. And what a blessing it was to teach these dual enrolled scholars about various health professions. It was something that I never had. I didn't know about being a physician assistant or going into public health, right? Or being an occupational therapist, right?
That's real.
Mm-hmm.
And like talking about that exposure, and it's crazy because you said like you went to school a long time ago, but I feel like it's still a lot of the same of like people just not knowing about public health or knowing about like other roles in health outside of like that physician. Of course, the pandemic has made it a little bit better in some senses, but still not where we would ideally like to see it. So yeah, that work is definitely needed, and I feel like especially the kind of work I think you're doing with also heroes, focus on like high schoolers and ensuring that like they get that information, because that is something that I think we don't talk about enough. Because like to your point earlier in your interview, you said you weren't ready for like college going after high school, and I think that is the case for many people out here, especially when we don't know what we want to do. So so you're the co-founder and CEO of Heroes Ed, higher education resources for organizations and empowerment services. How did you start this, and what do you all do?
Okay, so how did I start it? Funny story. I'm such a storyteller. So there was a student, May. I met May when I was at Hopkins, and May wanted to be a doctor. And so she said, hey, you worked at a medical school. Can you help me? And I said, sure, not a problem. May needed a lot of work. May was smart. She was smart, but she needed a lot of work. And so I said, well, what do you need help with? She said, all of it, like from studying from the MCAT all the way to my interviews. And I thought, oh, wow. Okay. Not a problem. I'm game. I'm game. So I told her how to study for the MCAT, told her what percentile to score in so she could get a full ride. A lot of people don't know that. May did it. Of course, it wasn't just she did it overnight. She studied for 6 months. I told her how to study. May scored, I think it was like in the 92nd percentile. So then she needed help with her personal statement. So I helped her with that. I think I ripped it apart, then we started all over. So 3 hours in Starbucks just doing that. Then May needed help with her interviews. So invited her to my apartment, and I had a list of questions it's called an MMI, multi-specialty mini interviews. And so we went through the questions. May needed a lot of work. And it was just like, hey, this is language that you use. This is language that you don't use. So Amari, guess what happened with May?
She was able to figure it out.
May got into Drexel on a full ride. May got into Hofstra on a full ride. May got into Case Western on a partial ride. So May graduated from medical school, not owing any kind of money whatsoever. So once May got in, she came back. She said, Ashanti, I'm going to take you out to dinner. So I said, all right. And she said, you know what? Why don't you start a business? And so I said, a business doing what? And so she said, doing what you did for me. Mm-hmm. And then I said, really? People have a business doing this? And she said, yeah. And so I said, oh, okay. And she said, yeah. She said, because if you had a business, hey, people would pay you a lot of money. So I did my research. Learned a lot about education consulting, and Heroes was born. I'm a nerd. I love DC and Marvel, and my husband, he's so good with acronyms, So with higher education resources for organizations and empowerment services, Heroes, oh my gosh. And that's what we do. But just with my dissertation, literature has shown and research has shown that with a lot of students, doesn't matter, Black, brown, or whatever, that road to health professions, we lose them when they're in college. So with Heroes, we not only work with high school students, we work with college students. So the majority of my clients, they're actually college students. Yeah, actually college students. And I provide them with academic coaching and career development. That's what I do. And I love it. Yeah,
I can imagine just hearing about the entire story up to now. That it makes a lot of sense. It's very telling. And I think also the side of just building on skills and knowledge as you go. And how that has been impactful into you getting into this position, as well as shout out to May for being hey, this is something that you could help a lot of other people with, because she was not lying about that. And it's definitely true. What was I going to ask? So what was that how long have you had this business, and what has been the progression of it?
Sure. So Heroes has been around since 2017. Mm-hmm. And I've worked with a ton of students, and they've gotten into some great schools like Brown University, Spelman, Morehouse, Morgan State, UCLA, UCSD, Hampton, Howard. So I love it. It doesn't seem like work at all. I have one client that I actually have to meet with her tomorrow. She's at Cal Lutheran, and she's a scholar athlete. So she plays soccer, and it's just a pleasure working with her, and it's just great just seeing how they transform and how they develop, You know, when we first meet and they're so green or they're so scared, and then seeing their confidence just build like, oh, okay, well, you know, I didn't get into that program, but that's okay. Let me figure something else out. Or the one that I have now, she's saying, yeah, you know, I like dermatology, but I think I want to go the PA route. And so I gave her an assignment and she did it. I want you to tell me the difference between a physician assistant and a physician. She nailed it. So now it's okay, let's work on your battle plan. When are you going to start studying for your exam? And she's right on it, right on it. And I love it. Love it. It doesn't feel like work. It's fun.
I love that. That's fun for you. And I think it talks back to your ideal about like being able to support yourself, but also like living a life that's full to you. And I'm guessing that you are able to control a lot more of the balance in that work. And I think it's like just awesome that you're mentioning this, because I feel like a lot of us think about like nonprofits and strategic plans, but we don't think about strategic plans for ourselves. And you highlighting just like figuring out, okay, what are the differences here? What is the actual thing that I want to do? And then what is the actual plan that I need to make and the actions I need to take to get to where I want to go? And I think that's important. And since you've worked with a lot of students, like what are some academic coaching tips that you would give? Maybe like one or two, and then as well as like career professional development type tips.
Sure. So one of my academic coaching tips is this. With students, especially high school students, please learn how to use the apps on your email. So if you use Gmail, learn how to use the calendar function and synchronize that to your phone. Put all of your assignments on that calendar and set notifications for yourself. That way you will not be missing any assignments. That's one of my tips. And that's a powerful one.
Simple and sweet. Yep. Mm-hmm. That's real factual. Mm-hmm. Awesome. And how about on the career professional development side?
So on the career professional development side, don't limit yourself. Look at where you want to be and then work backwards. What is the name of the job? What does it take to get there? Work backwards. So if it's, oh, Miss Ashanti, I want to be an architect. Okay, you have to go to college for that. You already know. And what kind of degree do you need? And what kind of classes do you have to take? So work backwards from that. And that's your battle plan. That's a hero's battle plan. And that's going to get you to your career.
Love the hero's battle plan name. That makes a lot of sense, and it makes you feel empowered.
Yes, we empower through education, Omari.
Exactly. We're trying to get to educational equity here. So I appreciate you, Shanti. And then for your dissertation, you kind of like alluded to it in doing some work around it, but like what is the focus of your dissertation? And you don't have to tell us like dig deep into it, but tell us what we need to hear.
Well, the overview is basically about how these health professions career pathway programs, how do they work? That's all I want to know. How do they work?
Love it.
How do they work?
Right. Well, we look forward to seeing how they do work, and you sharing that and becoming a doctor in the near future, because I know you've worked hard to get to this point, and you will get to that next point. So we look forward to that, and be sure to follow Ashanti when she becomes Dr. Ashanti Carter as well.
Thank you so much, Omari, for having me.
Yeah, you're most welcome. So before we get into the Furious Five, I would like to ask you, where would you like to see yourself in the future?
Oh boy. Either working as an administrator for a university or a community college, or doing Heroes full time.
Love it. And I hope that either one of those, maybe even a little bit of both, works out for you in your future, and we will follow along to see how that all unfolds.
Okay,
awesome.
Thank you.
You're most welcome. So moving on to the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
do your research, and you don't have to be so specific. Just do your research and look at something that you like, that you enjoy doing.
Yeah, great advice. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them? So you could talk both about being a doctoral student and as a business owner.
Okay, because I was going to talk about being a program director.
You can do that as well, too.
Okay. Being a program director, really have strong leadership skills and have strong communication skills.
Love it.
Yes.
Love it.
Mm-hmm.
Number 3, what's something you're working on improving in your life right now?
Taking better care of myself and making time for me. I have to do that. And even now it's kind of like, okay, just a little anxious, like, I think I want to go for a run tonight. I just want to go on the treadmill and just get all those endorphins just going. It's my mindfulness.
Love that for you. Love that for you. And hopefully that inspires someone else to go out there and take a little run or do some sort of activity. Number 4, professionally, do you recommend anything?
Yes. Always, if you know what it is that you want and just understand that college, it isn't for everyone. You can do an apprenticeship. Mm-hmm. Just have an idea of what it is that you want to do. Have an interest and make it fun, but do your research. Even if you're a gamer, people make money from that. Do your research. And then try to be the best at it. So you can do it. That's my advice.
Right. Do it and then dominate. Love it.
Mm-hmm.
And then number 5, last but not least, where can people connect with you, Ashanti?
Of course, you can go to our website, www.heroesed.com. And of course, you can find us on the gram at heroesed1. Yes, heroesed.1. And we are on the gram and we're there. Just, drop us a line. Say hey.
Definitely. And I'll be sure to link both of those below and in the show notes for anyone that's interested. So thank you so much for coming on, Ashanti, and sharing your story, your insights. It was very, very enjoyable to hear your story and your stories of stories. And how that all culminated into your insights. And I know this will be useful for a lot of people, so I appreciate it.
Thank you again, Omari, for having me. You have a powerful one, okay?
Yeah, you as well. Housekeeping items, everyone. Thank you so much for watching and listening to this. Be sure to subscribe if you have not as yet. Leave a like if you're watching this on YouTube. Leave a 5-star review and share it with a friend. It really helps to get out to more people and helps other people learn about different paths in public health. So thank you. Peace, everyone.